organizers of this Peace and Wellness Retreat for giving me an opportunity to speak to this highly motivated audience who is willing to invest in promoting peace and wellness in the universe. And we could not have asked for a better day to host this event than Mahatma Gandhi's birth anniversary. Honoring his legacy of peace and wellness, I would like to begin this presentation. My topic today is using food as medicine, getting back to the basics in primary care. The concept of using food as medicine is ancient and dates to Hippocrates, who is considered the father of modern medicine. But over the years, we somehow lost our way in the jungle of pharmaceuticals. We really need to work on getting back on track now more than ever, as the inferno of chronic disease is threatening to swallow the world. At this point, every person in the world is aware of the infectious disease pandemic caused by the novel coronavirus, SARS-CoV-2. As we all know, this is a highly infectious and communicable disease. Therefore, we are not gathering in person today. This dangerous infection has profoundly affected each person's life on this planet in some way or the other, and naturally the whole world is paying attention to it now. But there has been a different pandemic going on for a much longer period, and it is the pandemic of non-communicable chronic diseases. Recognizing this fact, CDC established a Center for Chronic Disease Prevention and Health Promotion in 1989, over 3 decades ago. We know that the ravages of COVID-19 are much worse in people suffering from chronic diseases. In order to gain control of the COVID-19 pandemic, we need to conquer these chronic diseases first. The reason these diseases are called non-communicable is that we do not give these diseases to each other by touching, hugging, or breathing, or coughing on each other, but we do transmit them through our changing cultural norms, such as the food we serve, the recipes we exchange, the habits and attitudes we pass on, the home and work environments we create, and so on and so forth. In this picture from their website, Center for Chronic Disease Prevention and Health Promotion has illustrated some of these chronic diseases, such as heart disease, cancer, chronic lung disease, stroke, Alzheimer's disease, diabetes, and chronic kidney disease, and also the key lifestyle risk factors leading to these diseases. In today's presentation, I would like to focus on type 2 diabetes. Type 2 diabetes can lead to several of the other chronic diseases, such as heart disease, stroke, Alzheimer's disease, and chronic kidney disease. And of the 4 key lifestyle risk factors listed, I would like to touch upon the relationship of poor nutrition with diabetes and how improving nutrition can help improve type 2 diabetes and sometimes even put it into remission. Obesity is rising at an alarming rate. 2/3 of Americans live with excess weight, which markedly increases the risk of type 2 diabetes. 25% of adults over 65 have type 2 diabetes. Did you know that for children born after year 2000, 1/3 are predicted to develop type 2 diabetes? That number rises to 50% for African American, Native American, and Hispanic children. So this is an animated map of self-reported obesity from the CDC website. It shows the increasing prevalence of obesity from 2011 to 2019. There are several maps like these around that track self-reported obesity over 30 years, 50 years, and longer, and they are far more startling than this one. Obesity, a condition where the body harbors excess fat in multiple places, is not just a nature's display of diversity. We, the people, are getting bigger every year, and that excess fat in our body goes way beyond impacting us psychosocially, such as changing our mood, self-esteem, quality of life, and body image, but it profoundly affects us at a cellular level. Excess fat is at the core of multiple chronic diseases. So let's start talking about type 2 diabetes. which is the adult onset diabetes, it's very prevalent today. It is different than type 1 diabetes, which typically starts at a young age and requires insulin for its treatment from the beginning. Our discussion today is about type 2, which starts in adulthood and does not require insulin in the beginning, but may require insulin afterwards, turning it into a type 1.5 and then type 1 diabetes. So how do we diagnose type 2 diabetes? We do a finger stick or a blood draw to see what the blood glucose level is. If you're in a fasting state where you have only had water after your dinner the night before and blood glucose level is above 100, then we consider it falling in the pre-diabetic range. If the level is above 126, then we call it diabetes. These numbers are chosen somewhat arbitrarily, looking at the data from many patients. When I started training, the fasting blood glucose number when we started calling a person diabetic was when their fasting blood glucose was over 140. But then it was found that a lot of patients already had complications from diabetes at the time of diagnosis. Therefore, the cutoff was changed from 126 around 1998. Hippocrates also said this: if someone wishes for good health, one must first ask oneself if he's ready to do away with the reasons for his illness. Only then it is possible to help him. So what causes type 2 diabetes? Is it our genes or is it our lifestyle? The answer is, it is a perfect storm. Type 2 diabetes is now recognized as a polygenic disease, representing a complex interaction among many genes and environmental factors. Even among groups with increased genetic risk for diabetes, however, environmental factors play a major role in development of diabetes. As an example, the prevalence of diabetes among Pima Indians in Mexico is less than 1/5 of that in Pima Indians in the United States, so 6.9% versus 38%. This fact was also proven in a study called Diabetes Prevention Program. So there was this large experiment conducted by NIH, National Institute of Health, on pre-diabetic people to prevent progression to full-fledged diabetes. You can see on the slide, the number of participants and how long it was done. The DPP participants were randomly assigned to one of the following groups. One was the lifestyle change group. These participants joined the DPP lifestyle change program that provided intensive training. And they tried to lose 7% of their body weight and maintain that weight loss by eating less fat and fewer calories and exercising 150 minutes per week. Researchers met with these people individually at least 16 times in the first 24 weeks, and then every 2 months with at least one phone call in between the visits. The second group was metformin group, where people took 850 milligrams of metformin twice a day and were provided standard advice about diet and physical activity. Metformin is a prescription medication that's commonly used to treat type 2 diabetes. And then third one was the placebo group, where people in that group took a placebo twice a day instead of metformin and were provided standard advice about diet and physical activity. So about 5%, what were the results? 5% of the participants in the DPP lifestyle change program developed diabetes each year during the study, compared with 11% of the participants who took a placebo. So the lifestyle change program was more effective than taking metformin, which is a medication used for treating diabetes and has known side effects. So essentially, the participants in the lifestyle program lowered their chances of developing type 2 diabetes by 58% compared with people taking placebo, which is a pill without the medicine. So did the genes make a difference in the DPP program? 45% people were from minority groups that are at high risk for the disease, including African American, Alaska Natives, American Indians, Asian Americans, Hispanic or Latino, and or Pacific Islanders. It also had other high-risk groups for type 2 diabetes, including people ages 60 and older, women with a history of gestational diabetes, and people with a parent, brother, sister, or a child who has type 2 diabetes. It turned out that even those at very high genetic risk had substantial reductions in risk when environmental factors such as overweight status, obesity, a sedentary lifestyle were corrected. So what happens with diabetes inside our bodies? The features are hyperglycemia, meaning high blood sugar, insulin resistance, and relative impairment in insulin secretion. And I'm going to explain these things as we go on. Let us take a dive to a cellular level and first understand how things are supposed to function normally. Now we will look at the physiology of digestion and assimilation and understand the structure and function of human digestive system. When we fully understand how our digestive system works, we can consider what food is best suited for our bodies. So I would like to examine your hands and notice your blunt nails and feel the edges of your teeth with your tongue like this. We neither have the sharp claws nor the pointy canines like the cats and dogs. We have cutting teeth in the front, our incisors, and grinding teeth in the back, our molars. So we are very well suited for food that requires cutting and chewing, like this apple. You can cut into it and then chew. And we've been blessed with a fascinating apparatus to help us digest and assimilate our food. The process of digestion starts as soon as we lay eyes on the food. It makes us salivate. It also signals the brain, which takes necessary steps to notify the involved organs, such as pancreas. Once we cut and chew, it mixes with our saliva. It creates a ball of food we refer to as bolus. As we swallow it, it goes down our esophagus and gets into this bag called stomach, where it mixes with a very potent acid and starts breaking down. Then it is poured into the small intestine. We've been given a very long small intestine, nearly 22 to 23 feet, so about 7 meters long, to help us break down the food to very small molecules. To break the food down to such microscopic molecules, we need help of enzymes, in addition to the mechanical churning and mixing actions provided by the muscles of the intestine. So right as the stomach empties its contents into the small intestine, digestive juices from the gallbladder and pancreas empty in the small intestine and mix with the bolus of the food. And as the food is passing through this lengthy small intestine, the digestive enzymes are processing the food into smaller and smaller and smaller particles until they are tiny enough to be absorbed into the bloodstream and assimilated into the body. These enzymes break down starches into glucose, fats into fatty acids, and protein into amino acids. Now let us focus our attention on this small, delicate, and extremely complex organ called pancreas. It sits in this cradle-like curve created by the first part of the small intestine, like a baby. Pancreas plays an important role in digestion by secreting lots of digestive juices, which are poured into the gut via this small tube. Pancreas also contains special kinds of cells called beta cells that secrete a hormone called insulin. Insulin is not poured into the gut, but it gets secreted directly into the bloodstream. Now let us ponder over the question of what exactly it is that insulin does in our body. One of the things that we should understand here is that the bloodstream is our transportation system, not our storage organ. It carries things from here to there, like our highway system. Even though we are these complex multicellular creatures, many actions still need to happen at a cellular level. For example, when we take a deep breath and fill our lungs with air, the oxygen from the lungs dissolves in the bloodstream and is taken to each individual cell so that each cell can breathe. We call that cellular respiration. Similarly, when we eat, our gut receives the food, breaks it down to fine molecules. The bloodstream picks it up and takes it to each individual cell so that each individual cell can eat. Glucose, which is the primary and preferred fuel for our cells, does not do us any good just circulating in the bloodstream. It needs to enter the cell to be broken down for energy. And this is where insulin comes into play. Another important thing to also recognize here is that we cannot keep too much glucose in the bloodstream at any one point, as it would make our blood thick and sticky like a syrup. As we know, syrup doesn't flow as well as water, and it is no surprise that people with uncontrolled diabetes get circulation problems. In our bodies, even essential chemicals have to follow a certain pathway to enter inside the cell. They cannot just barge into the cell. So there is a special channel through which glucose is supposed to enter the insulin. Insulin acts as a key to open that special channel. So here's a diagram of a muscle cell, which is the biggest consumer of glucose for energy. As you can see, as soon as insulin fits in a special receptor and sends a chemical signal across the cell to help open the glucose channel, glucose molecules enter the cell, and the energy is generated during its breakdown process. In type 1 diabetes, which typically happens at a younger age, the special beta cells in the pancreas that make insulin are destroyed by an autoimmune process, and the key to open the glucose channel is missing. But in type 2 diabetes, the one we are seeing an epidemic of, there is still plenty of insulin to go around, at least in the early stages of diabetes. But the key does not seem to be working properly. And when examined carefully, there seems to be nothing wrong with the key, but the lock seems to be jammed. Scientific evidence suggests that the muscle cells have accumulated fat globules. It is termed as intramyocellular fat. That intramyocellular fat blocks the signal transmission inside the cell to open the glucose channel. As a result, glucose cannot enter the cell and builds up in the bloodstream. This is known as the state of insulin resistance. As the blood glucose level rises, the brain senses it and orders the pancreas to secrete more insulin, which it does. So in the very early stages of type 2 diabetes, even before it is diagnosed, people have hyperinsulinemia or high levels of insulin. The point in making is that rising blood glucose is a symptom, not a cause of type 2 diabetes. Blood glucose level is rising as the glucose cannot get inside the cell to be broken down for energy. It is locked out of the cell due to fat accumulation inside the cell, causing insulin resistance. So if we want to merely manage the diabetes, just cutting down on the foods that turn into glucose will help. But if we want to treat it at its root cause, then we need to work on getting rid of the intramyocellular fat. This means getting rid of the obesity at a cellular level. So where is this intramyocellular fat coming from in our food? From all the rich foods we are eating. So basically, the animal foods and vegetable oils is the biggest source of fat in our diet. So here in this slide, we are looking at the metabolism of macronutrients. Macronutrients are the food components that we consume in large quantities, as opposed to the micronutrients that we consume in minute quantities. The three macronutrients are starches, or more popularly known as carbs, fats, and then also fats and proteins. Micronutrients are vitamins and minerals. Under normal circumstances, our body is programmed to use the macronutrients in the following way. Starch or carbs, as a rule, they burn with minimal effort. Fat generally stores with minimal effort, with just 3% of the energy. And protein is used to build and repair with minimal effort. Converting starch or protein into fat is a very energy expensive process. It requires 30% of energy. So body avoids the conversion of starch into fat unless we consume pure sugar, which can be turned into fats called triglycerides very easily. So generally, the fat we eat is fat we wear. Now, let us see what has happened with industrialization of food. We have discovered the tools to ultra process our foods, and we are doing it rampantly. In addition to having to produce more insulin, due to insulin resistance, our digestive system and pancreas has been experiencing an unprecedented number of novel foods that have been altered profoundly from their original form. Here, we are looking at an enlarged cross-section of a grain of wheat. A whole grain has a cover called bran, which is full of fiber and some B vitamins and minerals. We typically get rid of that, either intentionally or it blows away at the very high machine speeds, machine grinding speeds. We also tend to discard the inner core called germ, which is packed with B vitamins, vitamin E, and some beneficial antioxidant phytochemicals. It also contains some omega-3 fatty acids that we value a lot for reducing inflammation. After removing the bran and germ, what is left is starchy body of the grain called endosperm that we grind to get that nice, fluffy, all-purpose flour. In the process of removing bran and germ, we lose 23 different essential vitamins and minerals. And we try to make up for it by adding 4 B vitamins and iron. We call that enriched flour, but we still are in net loss of 18 different vitamins and minerals. So the food that originates from this flour has calories, but not proportionate amount of nutrients, making it a calorie dense but nutrient dilute food. The benefit we do get from refining the grain is increased shelf life and convenience, which can be a useful attribute to carry and extend food to the remote parts of the world, but using it on a regular basis can be a big nutrient loss for our bodies. And we use this enriched all-purpose flour to make white bread, bagels, biscuits, crackers, cookies, cakes, flour tortillas. We also add more processed things like oil and sugar to make these things from the already ultra-processed all-purpose flour. And some of these things can even be homemade, but these are still processed foods. Moreover, breaking down the food too finely before consuming means starting the process of digestion even before it enters our digestive system. And as we discussed earlier, we've been gifted with a very sophisticated apparatus to do the digestion and assimilation of our food. When we partially digest our food outside the body with help of the machines, it affects the body in many adverse ways. And let's see how. So this is kind of a long explanation here. Every step of process of eating food has a role to play in the process of digestion. So when we eat naturally occurring foods, digestion happens gradually, giving an opportunity for the products of digestion to get assimilated. So the insulin release that is required for assimilation of digested starches also happens little by little, proportionate to the amount of glucose released into the bloodstream. Consumption of naturally occurring minimally processed foods gives plenty of notice to the pancreas to secrete enough insulin to make sure that the blood glucose in the blood does not exceed 200 at any given point in normal circumstance. Let me explain this with example of eating an apple with 3 levels of advanced intimation to the pancreas. So when we hold this apple in our hand and look at it with anticipation, and our brain thinks we are about to eat it, not only we start salivating, but our brain also is signaling our digestive system to warm up. As soon as we take a bite into this juicy apple, the sweet juice drenches our tongue. Humans as species have the taste buds for sweet food strategically located at the tip of our tongues. And this is by design, as glucose happens to be our primary and preferred fuel. And we are wired to seek out sweet foods. When a sweet taste is perceived, the pancreas starts taking steps towards making insulin. As a result, the diet drink that has 0 calories but an intensely sweet taste could push the pancreas to make more insulin. People consuming a lot of diet drinks have been shown to stay in a constant state of hyperinsulinemia, leading to more hunger and consumption of more calories and obesity. The third and the confirmatory signal for the pancreas to ramp up the insulin production is the action of a digestive enzyme called amylase that resides in our saliva. It begins the process of digestion of starches by separating a few glucose molecules from the long starch chain. As soon as those glucose molecules enter the bloodstream, pancreas starts releasing more insulin. So it kind of ramps up the production of insulin. But when we consume a food like a saltine cracker, for example, that is made from all-purpose flour, it breaks down much faster than anticipated, like a cracker would turn into mush in our mouth pretty quickly, right? So because it has been partially digested outside the body by removal of bran and germ. This rapid release of glucose puts more pressure on the pancreas to make and release a lot more insulin at one time. Now, finally, take the example of an extremely processed food such as table sugar. The white powdery appearance of the table sugar has no resemblance whatsoever to its source, which is sugar cane, which looks like a bamboo. Think of how many processes we have put it through to get the sugar extracted from it. Each molecule of that table sugar is made from 1 molecule of glucose and 1 molecule of fructose. Imagine what happens when you put a pinch of sugar on your tongue. It simply dissolves and appears almost instantly into the bloodstream. Just the amylase in the saliva is adequate to finish the digestion of the table sugar completely. So there isn't much time in between tasting the sugar and it's coming into the bloodstream. So the process of digestion has been severely short-circuited, pushing the pancreas to do a supranormal feat. We start the abuse of this poor organ very early in our life by feeding our children candies, crackers, cookies, cakes. I've been guilty of it also. When my children were younger, as it was very convenient to grab a packet out of the pantry as we are rushing around to get places in our modern life. A better snack could have been an orange or a banana, but now I've seen the dire consequences our modern food choices have created, and I'm reformed now. Insulin resistance is pushing the pancreas to make a lot more insulin than normal as brain senses the rising blood glucose level. And processed food breaks down very fast in the digestive system, and this pancreas is compelled to make a lot more insulin in a short period of time to assimilate glucose. And both of these above actions are leading to exhaustion of this poor organ, leading to impaired insulin secretion and ultimately failure to produce insulin, converting type 2 diabetes to type 1, which requires injecting insulin on a regular basis to help assimilate glucose. So I urge you to take a pledge to heal your pancreas today. And how can you do that? By 3 things. One is avoid the rich fatty foods, which are primarily animal foods, beef, pork, chicken, fish, turkey, eggs, and dairy. Avoid ultra-processed foods, vegetable oils, sugar, all-purpose flour, and eat plenty of colorful, non-starchy vegetables, starchy roots, variety of whole grains, legumes such as beans and lentils, plenty of fruit, and small amount of nuts and seeds, and fatty fruit like olives, coconut, avocados. In other words, eat a whole food plant-based diet without processed foods such as sugar and oil. And remember, that there is no war between macronutrients. All naturally occurring foods contain a little bit of all macronutrients. So even this apple has 2% protein, and there is plenty of protein in plant foods. Whole foods and isolated concentrated nutrients are the two things that we need to understand. These are separate. So sugar is an isolated concentrated starch. And oil is isolated concentrated fat. We are not meant to eat those. We are meant to eat whole foods. So in the last 7 years of using a whole food plant-based diet as medicine, we've seen several patients at Flora Medical Clinic putting their type 2 diabetes into remission by healing their pancreas. And I hope many people can do the same. And finally, to end this talk, here's my favorite food prescription to my patients, adapted to the style of great Dr. Seuss.
Do I have a real remedy for your malady? Would you eat green leaves and yam?
I do not like them, Doc. I do not like green leaves and yam.
Would you like them at breakfast or lunch, or any time you want to munch?
I would not like them at breakfast or lunch. I would not like them when I munch. I do not like green leaves and yam. I do not like them, Doc.
Would you eat them on a plate? Would you eat them with your mate?
I do not like them on a plate. I do not like them with my mate. I do not like them at breakfast or lunch. I do not like them when I munch. I do not like green leaves and yam. I do not like them, Doc.
A box, a box, a box. Would you like them in a box? Would you like them in your Crocs?
I do not like them in a box. I do not like them in my Crocs. I do not like them on a plate. I do not like them with my mate. I do not like them at breakfast or lunch. I do not like them when I munch. I do not like green leaves and yam. I do not like them, Doc.
Would you, could you, under a tree? Eat them, it's my plea.
Not under a tree, Doc, let me be. I would not, could not, in a box. I would not, could not, in my Crocs. I will not eat them on a plate. I will not eat them with my mate. I will not eat them at breakfast or lunch. I will not eat them when I munch. I do not like green leaves and yam. I do not like them, Doc.
Say, in the sun, here, in the sun. Would you, could you, in the sun?
I could not, would not, in the sun.
Would you, could you, just for fun?
I could not, would not, just for fun. Not in the sun, not under a tree. I do not like them, Doc, you see. Not in a box, not in my Crocs, not on a plate, not with my mate. I will not eat them at breakfast or lunch. I do not like them when I munch. I do not like green leaves and yam. I do not like them, Doc.
You do not like them, so you say. Try them, and you may. Try them, and you may, I say.
Doc, if you will let me be, I will try them, you will see. Say, I feel so good. I like green leaves and yam. I like them, Doc. And I would eat them just for fun. And I would eat them in the sun. And in a box, in my Crocs, and on a plate, with my mate. And I will eat them under a tree. They make me feel so good, you see. So I will eat them at breakfast and for lunch. Say, anytime I want to munch. I do so like green leaves and yam. Thank you, Doc.
So I would be very happy to take any questions now.
Bharati, that was so good. Thank you so much. There are a bunch of questions that people send me directly in the chat, and I will read them out right now. But before I do that, I just want to say that was an excellent presentation. Both medical and non-medical people learned a lot, I'm sure, because you explained everything so nicely.
Thank you.
Okay, well, I'm going to start reading in the chat, but if you guys want to unmute yourself and ask yourself as well, feel free to do that. Okay, so first question is, where does the excess glucose go if it can't get into the cells? Does it go to the liver?
So the excess glucose, a lot of it gets converted into glycogen, which is kind of a complex starch that our body stores. And it does get turned into the triglycerides, as I said, when it's too much of it. And the triglycerides will create plaque and lead to atherosclerosis and heart disease. And it essentially creates complications. There's not a whole lot left for it. But in normal circumstances, if you're not a diabetic, if you eat too many starches, we convert it into glycogen and also burn them into like a thermal energy. We try to, we are very well equipped to burn starches in general for energy, but in case of type 2 diabetes, the excess is way too much and getting it locked out of the cell. So the triglycerides will deposit in the liver, causing fatty liver.
Another person said, my wife loves pasta. What would Dr. Kolte recommend? Are the new lentil-based and other pastas better for us?
I would say whole grain pasta would be fine. You know, the regular pasta that's made from all-purpose flour is very processed, but whole grain pasta or lentil pasta, they are fine too.
Okay, somebody said, can she also comment on beans, pinto, kidney, etc.? Are these a good source of carbs and fiber?
Yes, beans are excellent source of starches, complex starches and fiber. And beans also give, complex starches like beans and lentils and whole grains and potatoes and sweet potatoes give us a lot of fiber that creates a good framework for our good bacteria to stay in. So they act as prebiotic. So there is this whole fascinating area of gut microbiome that is being developed and changing every day as our understanding increases in that area. And all these whole complex starch foods are very helpful to help these bacteria live, because taking a probiotic is, it's like a breeze. It comes and goes. It doesn't stay alive unless you provide, ecosystem for it to stay in.
Also, if she could comment on healthy fats, long chain polyunsaturated fats.
So healthy fats, as I said, there's really no war between macronutrients. If the healthy fats are consumed in the original form they come in, nuts and seeds and fatty fruit, they are good. But you have to keep in mind, nuts and seeds are sort of treasures of the plant kingdom. Nature has hidden them in shells for a reason, right? So somebody else now shells them from us and puts them in big bags in Sam's Club and Costco, and they're very easy to get to. So, think of how many nuts you would have realistically consumed if you were to, break it apart and yourself and eat it. And, I think nature has given us a very good guidance about what we should be eating more of and what we should be eating less of. So things that we should be eating more of, you can bend down and just get them, right? You get your potatoes and sweet potatoes and the leafy greens that grow on the top of it. And as, the height increases, the berries and cherries and most of the vegetables are very low on the ground level, easy for man to get.
You're right. I never thought of that. Like even dates and coconut.
Yes.
Those are hard to get to.
I always say, look where coconut hangs. and have you tried opening a coconut? It's so hard.
You have to burn a few calories before you can get to it.
Yes, absolutely.
There's some comments here. Somebody said that was adorable. And I agree. I think the video was so cute. Someone said that was awesome, an excellent talk. I love that video. Wonderful presentation. Thank you. Thank you, Dr. Kolte. Please, can we have the video on the PPF channel? Can we have it on our YouTube channel? Would that be okay with you?
That would be fine.
Okay, so it'll go on the nonprofit's YouTube channel. Are you going to give us the copy of the presentation? Someone's asking.
I guess, yeah, I mean, it's kind of long, but if you want it.
More comments. Thank you. Great information. Thank you so much, Dr. Kolte. I would really like to watch the recording of this several more times. Thank you, Dr. Kolte. That was an excellent presentation. I'm going to really look for question now because there are lots of thank yous for you.
I have a question.
Please.
So I have just started, this journey, and people around me, my loved ones, a lot of time they scare me. They said, it's okay now. You're doing all this. 20 years from now, you will see the results, and you may not have, enough protein when you are really old. And so are there any long-term studies, like people like me who have started in their 50s, and then, what kind of impact and it has? And everybody scares me about, lack of protein, bones, and I'm not having yogurt and how it is good for you. So you're surrounded by all the, people who, very lovingly make you doubt your choices. So any long-term studies of, any red flags or anything we need to watch out as we get older?
So there are a lot of long-term studies. In fact, the Adventist Health Study, and basically there are several studies that have shown the effectiveness and that there is no lack of protein in a plant food. So like, as I said, even apple has 2% protein, and orange has 8%, potato has 18%, and spinach is 40% protein, mushrooms are 50% protein. So as long as you're consuming a variety of whole plant foods, there is no dearth of protein, as long as you're consuming enough calories. If you, go on from an animal food-based diet to, you could be perfectly vegan by eating Oreo cookies and potato chips and having Coke, but that is not a good diet. If you're consuming, tons of non-starchy, colorful vegetables, as well as starchy vegetables and whole grains and beans and lentils and tofu and tempeh and kind of wide array and small amounts of nuts and seeds and fatty fruit. As long as you're consuming enough calories through all of these, there is no danger of protein deficiency, and that has been proven quite widely. So as Dr. Vandana and Manish would also agree with me.
Yeah, Shalja, I would actually tell your relatives to look up the blue zones, because these are the areas of the world where people live really long lives and really healthy lives. And it turns out all the blue zones, they're eating a predominantly plant-based diet, not completely. About 17, 18 of their 21 meals a week are plant-based. Yeah. So we know those 102, 103-year-olds, they're not bedbound, they're not needing wheelchair, walker, they're not having osteoporosis, and they're mainly eating plants. And I'll give you another example. I don't know if you met my nurse practitioner, Virginia.
Yes.
She's 82 and she's been plant-based for over 25 years.
Oh,
and
great.
She has a glow and she looks much healthier than I do. So.
Yeah. I haven't met her, but I want to meet her.
Yes. Bharati, there are a few other questions. There's one that says, what do you think about intermittent fasting?
Oh, intermittent fasting is a wonderful idea. I think it's, now it has made a comeback, but intermittent fasting is not new to any of us. I think naturally, before electricity, no one was eating from sundown to sun up. So 12 hours of daily intermittent fasting was very natural. 12 to 14 hours on a regular basis is a good idea. It gives the digestive system a break. And then, there's virtually no culture or religion that did not have some way of fasting. So that is, a very long tradition in many religions, and it's actually quite healthy to give your body a break, every so often, in addition to the daily 12 to 14 hours at nighttime.
Thank you so much, Dr. Kolte. There's going to be many more questions. So we'll kind of take a tally of them and we will get to you and get their answers and get it to them. Since it's getting close to 10 o'clock, I'm going to ask everyone to just take maybe a couple of minutes break and we'll start the yoga session shortly. Thank you so much, Dr. Kolte.
Thank you.
Thank you. It was wonderful.
Thank you.
Welcome back, everybody, and thank you again to Rafael Sarango for that wonderful yoga sequence. We're moving forward now with 2 TED-style talks. The first will be by Dr. Nancy Erickson. Let me tell you a little about Nancy. So Dr. Nancy Erickson is an associate professor of maternal fetal medicine at Baylor College of Medicine. She's also board certified in obstetrics and gynecology and lifestyle medicine. She's the principal contributor for preconceptual health and pregnancy for nutrition modules in American College of Lifestyle Medicine, and is co-editor and author of a new book, Lifestyle Medicine, Women's Health Across the Lifespan. In her talk today, Dr. Eriksen will focus on the power of whole plant foods in keeping women healthy during pregnancy and throughout their lifespans. Let's welcome Dr. Nancy Erickson.
Thank you very much for that introduction, and it's a pleasure to be here today. I'm sorry we couldn't be in person. That's kind of sad, but thankfully technology can get us all together too. And obviously my talk today is focused on the reproductive age woman. And even if you're not in that place, you can still have an impact with friends and families around you with the knowledge and inspiration that hopefully I will convey today. This picture is of a gentleman, and actually was a physician. His name is Carl Taylor. I had the pleasure of getting to hear him several years back because he was so influential in the field of public health. And he had a long career, probably 60 years or more, visiting 70 countries, and was actually the chair of international health at Harvard. And one of the things that I think was very interesting that I learned from him was what he kind of distilled down of the things that he learned over the years. And he was quoted as saying that women can, in action groups, solve the majority of their family health problems. And when you think about that, that makes a lot of sense, because women are typically the primary caregivers in the home. They often shop for the groceries, do the meal preparation, and take their kids to the doctor. So today I want to review kind of 3 different areas. One is the concept of preconceptual chronic disease and pregnancy outcomes, and just the importance of nutrition and managing that. And then shift over to epigenetics and fetal program, and then finish off with a little bit about nutrition during pregnancy and childbirth. So one of the things I get to do in the office is consultations. Not a lot. Unfortunately, a lot of women don't realize the impact of chronic disease on their future pregnancies. But those that I do, these are some of the topics or the chronic diseases that I do see. Obesity, chronic hypertension, diabetes, autoimmune diseases, inflammatory bowel disease, and heart disease. And what do these all have in common? Well, in fact, it's the dietary patterns, because that's typically what results in these chronic diseases. And one of the more common ones is actually obesity. It's actually the most common chronic disease that OB-GYNs see in the office, and roughly 39% of women between the ages of 18 and 44 are actually obese. And what we know is that when the mother is obese, that often translates to childhood obesity for multiple different reasons, which we'll go through. So just to kind of reflect what some of the maternal and fetal complications are for obesity, or women with obesity, I want to just go over this little list because oftentimes women don't realize that they are more likely to be infertile from anovulation or polycystic ovarian syndrome. They also have a slightly increased spontaneous abortion or miscarriage rate. Hypertension during pregnancy, whether it's chronic hypertension or preeclampsia, is common, as well as gestational diabetes, DVT, which are basically blood clots. And they also have an increase of bigger babies, which can result in labor dysfunction and ultimately cesarean section. And they also have an increased risk of ICU admission. That can range anywhere from 1% to 6%, depending on what your BMI is. So what are some of the fetal risks? Well, actually, one of the problems that we see in women with obesity is just a micronutrient deficiency, and that can translate into an increased risk for congenital anomalies, in particular spina bifida and congenital heart disease. And we know that there's a linear correlation with the BMI and the risk of these congenital anomalies. That is, the higher your BMI, the greater the rate of these birth defects. They also have an increased risk for preterm birth. That's primarily due to medically indicated preterm deliveries, usually from hypertension during the pregnancy. They can have large for gestational age babies, resulting in increased birth weight, and even birth trauma, which can have long-lasting ramifications. And then for women with a BMI greater than 40, the stillbirth rate is increased. During childhood, women who have obesity have an increased risk of having their offspring also have obesity, as well as an increased risk for metabolic syndrome, type 2 diabetes, and even developmental delay, autism spectrum disorder, and ADHD. And those last three topics are thought to be due to micronutrient deficiency. So again, the importance of nutrition for correcting that. So the American College of Obstetrics and Gynecology, or ACOG for short, suggests that patients obtain a normal BMI before attempting pregnancy because a high BMI is associated with infertility and maternal and fetal complications. The World Health Organization recommends a BMI less than 30 also to reduce pregnancy complications. And what I convey to these women is, even if that's a lofty goal, depending on what your BMI is currently, even if you lose 5 to 10% of your body weight, that can have significant improvement, not only in metabolic health, but also in lowering your risk for maternal and fetal complications. And before I leave this topic, I want to go over this little cartoon, which is kind of interesting from the standpoint of, let me bring up this laser pointer. This top rung is basically the association of chronic diseases and the occurrence of adverse pregnancy outcomes. That could include things like gestational diabetes, preeclampsia, preterm labor, stillbirth, a whole host of things. But this particular slide deals with hypertensive disorders in pregnancy. And I want you to see what ends up happening over time. And that is chronic diseases increase the risk for adverse pregnancy outcomes, which also in turn increase your risk for cardiovascular disease and hypertension within 10 years. In fact, about 52% of women who are diagnosed with preeclampsia alone, meaning no pre-existing chronic hypertension, 52% will go on to have hypertension within 2 years. And then within 10 years, you can also see things like coronary artery disease, stroke, heart failure, and increased risk for mortality. And there's also a reciprocal relationship between these chronic diseases and adverse pregnancy outcomes. That is, chronic diseases increase adverse pregnancy outcomes. And even if you don't have a pre-existing chronic disease, those adverse pregnancy outcomes are like a canary in the mine. It's an early warning device, so to speak, to let you know, or let your patient know, or whomever you're taking care of, that they do have an increased risk for chronic disease over time. So what's the answer? Well, I recommend whole food plant-based diet, and that's for many reasons. There are more and more studies coming out, randomized control studies and large prospective studies showing that the whole food plant-based diet is the most beneficial as far as preventing and reversing chronic disease, including obesity. And in a randomized controlled trial comparing 5 different dietary types, ranging from omnivore to pesco vegetarian to vegan and a couple of others thrown in, the whole food plant-based diet actually had resulted in the largest percent of body weight decrease, which was like 7.5% compared to around 3.2% for all of the groups combined. So it's very beneficial from the standpoint of reversing disease. But the other aspect of it, because it's so healthy, it increases your micronutrients, which are really needed during pregnancy. So shifting gears here just a little bit, I want to talk about the role of epigenetics and why it's so powerful to change your diet before you get pregnant. And that is, epigenetics really, simply defined, are how the experiences of previous generations can affect who we are. This cartoon kind of depicts how lifestyle behaviors during pregnancy can impact the baby's future health. So things like diet, pre-existing disease, and including adverse pregnancy outcomes, smoking, alcohol use, and even endocrine disruptors or environmental toxins all have an impact on the baby. And not just the baby, but also the reproductive cells of the 3rd generation. That is to say, what you eat during your pregnancy impacts up to 3 generations. And it does that primarily through modification of the epigenome, which is the non-DNA portion of your chromosomes. And it does this through a process of either hypo or hypermethylation, as long with histone modifications. And it actually causes a difference in the way the genes are expressed. So one of the ways I like to explain this is, for example, we all have electricity coming into our home, but we can change how it's expressed by using a light switch. We can either turn on or turn off the lights and control the expression of the electricity through our house just through a switch. And in a similar way, this is what happens based on lifestyle behaviors during the pregnancy. It turns out too that the most impactful time to try and change the epigenome is either around the time of conception, periconception, or during the early gestation, typically up to about 16 weeks, which is 4 months. And in this slide, you can see that in early development, the epigenetic changes are more likely to occur. That's not to say that changing your diet later in the pregnancy does not have an impact. It's just, as far as gene expression and altering the epigenome, that's where your biggest return on investment is. This is why I emphasize to women, if possible, to change their dietary habits before they get pregnant. These obesity in particular can also not just cause epigenetic changes, which predispose the babies to lifetime disease like altered metabolic syndrome and childhood obesity, but can also affect the flow of nutrient transports across the placenta, and then eventually affect the microbiome in the baby. So I want to review just a sample of studies about nutrition during pregnancy. Unfortunately, time doesn't permit me to do a deep dive, but as far as epigenetics is concerned, the most famous studies originated out of the Dutch potato famine, in which the Nazis invaded Holland during the winter of 1944 to 1945, and a lot of women were subjected to starvation, consuming less than 700 calories a day. And their daily ration was 2 potatoes, 2 slices of bread, and a half of a beet. So you can see that not only were they calorically restricted, but they were also restricted in nutrients. And years later, they did epigenetic studies and showed that those that were exposed in early pregnancy had children with increased glucose intolerance, obesity, heart disease, and breast cancer. Women who were exposed later in the pregnancy had smaller babies, but there wasn't such the predisposition for childhood disease. And that's, again, due to the fact that dietary patterns have the greatest impact early in pregnancy. Well, what about high protein, low carb diets, ranging either from ketogenic to paleo, et cetera? We know that one study showed that even when you control for factors such as maternal hypertension, weight, and smoking, the adult children actually had higher blood pressures 40 years later and higher cortisol levels, indicating a long-term impact on what the mother ate. They also increase the risk for gestational diabetes and preeclampsia. And I've had several patients that I've talked to who are eating paleo during the pregnancy, and I explained to them that they're going to increase the risk for gestational diabetes. They wanted to stay on paleo to try and control their weight gain, but unfortunately, nearly all of them were diagnosed with diabetes, and a good number of them were also ended up with preeclampsia. And then, as I mentioned later, micronutrient deficiency increases the risk for spina bifida. When you're on a high protein, low carb diet, you're usually deficient in folate levels, which again is directly correlated with spina bifida. Another study that looked at spontaneous abortions. These are women that unfortunately lost their babies mid-pregnancy, and they looked at and compared women who are on high cholesterol diets compared to women with on lower cholesterol, and noticed that there were fatty streaks in the aorta, which is the big vessel that comes out of the heart. And that's pretty significant when you think of, in the past, we used to think of heart disease or a coronary artery disease beginning in adolescence. And what we now know is it actually begins in utero. And then there's really only one study that looks at low-fat vegan during pregnancy, and this was a retrospective study, so not the best design. But what was interesting was this was a group of women who were all in the same community, had good, strong relationships. They were non-smokers, physically active, and ate a lot of organic produce. And what was astounding, as far as I'm concerned, is what's a low prevalence of preeclampsia, 0.1%. And that's pretty significant when you consider that roughly 2 to 8% of all pregnancies undergo preeclampsia, which, oh, by the way, is one of the leading causes of maternal death in the first week after delivery. So the moral to the story is we are what we eat, and what we eat during pregnancy affects the risk of disease in childhood and even into adulthood. So again, just to review some of the basic concepts of the benefits of improving nutrition or dietary patterns, and I focus on dietary patterns, not so much individual micronutrients or supplements, because the supplements don't work as well as far as decreasing all-cause mortality, nor are they as easily absorbed as nutrients that are obtained through food. So basically, changing your nutrition before you get pregnant can improve your maternal health and can prevent or reverse chronic diseases. It definitely improves your micronutrient status. You can have a decrease in the risk of congenital anomalies, as well as a decrease of risk of adverse pregnancy outcomes. And finally, you can decrease the risk of chronic disease in future pregnancies. So what to eat when you're expecting? Again, I recommend a whole food plant-based diet. Now, admittedly, there's not really many studies looking at this, but what I can tell you from doing a large review for a chapter I recently wrote is the higher the fiber in your diet, which is from plant foods, the better the outcomes during pregnancy. So if you're going to do this, you want to eat a variety of different plants to make sure you get all the micronutrients you need. And one of the things that you could do when you're making this change is work with a registered dietitian who's familiar with plant-based diets, or a lifestyle medicine doctor who's familiar with plant-based diets, to kind of help you make sure that you're getting everything you need. And one of the most common questions I get is, well, is it safe? Well, yes, it is, because appropriately planned vegetarian, including vegan diets are healthful, they're nutritionally adequate, and can provide health benefits for the prevention and treatment of diseases. And they're appropriate for all stages of life, including pregnancy and lactation. And this is from the Academy of Nutrition and Dietetics. Again, nutrients of concern during pregnancy, although not listed completely on this table, include things like folate, which you can get from leafy green vegetables, and things like choline. DHA is kind of controversial right now. That's a whole nother topic. Vitamin D is really important. Having adequate vitamin D can reduce your risk in half of gestational diabetes, preeclampsia, and preterm birth. So this is I just wanted to compare the nutrient profile of the whole food plant-based diet, which is on the far right. This is macronutrients with the USDA MyPlate, which is currently what's recommended through the USDA. And this was a study that was done by Michaela Carlson, who's a PhD and not only a member, but works with the American College of Lifestyle Medicine. So you can see that the protein levels are pretty adequate, pretty complementary. But the biggest difference in the whole food plant-based diet is you get half of the fat. So there's a lot less. And one of the advantage of a lower fat diet is less weight gain during pregnancy. And then of course the fiber is more than double what's recommended. And you have to increase fiber during pregnancy, generally in the neighborhood of anywhere from 34 to 36 grams in the second and third trimester respectively. So the USDA MyPlate doesn't really get you there. What about micronutrients? Well, you can see here that the whole food plant-based diet actually is more than adequate for either meets or exceeds the RDA for virtually all the micronutrients looked at, including iron, which is again a nutrient of concern during the pregnancy. Usually you want about 27 milligrams of iron during the pregnancy, and the whole food plant-based diet will get you without even any supplements. And notice too that the folate levels are almost double what the USDA MyPlate is, which is really beneficial. The other advantage of whole food plant-based diet, as I mentioned, is fiber. And you need fiber anyway, but even during pregnancy, there's an increased risk for gastroesophageal reflux and constipation, which again, you can reduce through a high fiber diet. You can also reduce your risk for gestational diabetes and preeclampsia. And as far as preeclampsia is concerned, there's a linear correlation between the amount of fiber consumed and the risk for preeclampsia. More specifically, for every 5 grams of fiber that you consume, there's a 14% reduction in preeclampsia. And of course, once the baby's born, breastfeeding the baby is ideal for many different reasons. Obviously, bonding with the baby and also allowing the different antibodies to pass to the baby. But there's additional advantages too, and that is setting up the microbiome or the bacteria inside the gut of the baby. We know that babies who are breastfed have a decreased risk for obesity. And I just want to interject something here with a question or two, just to illustrate how interesting breastfeeding is as far as fetal growth and its relationship to protein. So the question is, what period in life do humans grow the fastest? And secondly, how much protein is needed to see that rate of growth? So here's a slide depicting the components of breast milk. Obviously, water is the biggest component, followed by fats. Most of these are omega-3 free fatty acids who are important for development of the brain. But notice that the protein level is less than 1%. And the period of time that the baby grows the fastest is in that first year of life. That means a baby who's exclusively breastfed for a year, which is awesome, can actually double their weight on less than 1% protein. And I always call this natural veganism. So moving on to childhood, your kids are going to be influenced by friends and family to either eat whole food plant-based or whole foods on the right or the processed foods on the left. And I think the moral to the story is the earlier you introduce these kinds of foods to your children, the easier it is for make healthy choices later down the road. And one of the ways too to increase interest is to actually involve them in meal preparation when age appropriate and in making the recipes. And I talk to the women in my office about, hey, why don't you start with something the kid really likes? If it's pizza or macaroni and cheese or whatever, is find a whole food plant-based version of that, because most of these kids would enjoy eating it, and adults for that matter, as long as they don't have to give up their comfort foods. So coming full circle, Dr. Carl Taylor, I want to sum up with a statement he had. At age 92, he was in a bamboo hut in Northeast India, and he asked a group of women how they would shape their future. And they answered, it's the empowerment of ourselves. So hopefully I've inspired you to make nutritional changes if you haven't. And even if you're not in the age group that I was speaking of, you have the ability to influence family and friends. And together we can do it, and we can have a health revolution. Thank you.
Thank you, Dr. Erickson. That was a wonderful talk, and I absolutely do feel empowered. And I hope the rest of us, men and women, are inspired after your talk. Do you have a few minutes? If somebody has a question or two, we can do a little bit of Q&A before we move on to the next talk.
I wanted to ask Dr. Erickson, when you have patients in your office and they're sometimes sort of reluctant to start on this path, what do you say to kind of encourage them just to try even walking the path a little bit?
That's a great question. Thank you. And I didn't add this in, but there is a caloric increase during pregnancy, especially. You want to increase your calories in the second and third trimester. And so I recommend adding those extra calories with whole foods. So even if they're not ready to make the plunge and get rid of some of the more harmful foods, even if they can add more nutritious whole foods to what they're already doing and crowd out their plate, that and the other suggestion I mentioned just a few minutes ago, which is start with the foods you really enjoy the most, find a plant-based recipe for it, and start there. Because if you find foods that you really like to eat, whole food, plant-based, you're more likely to make that shift and try other things.
So I have a quick question too. I am going through menopause.
Oh.
And I was wondering if you had any tips on how to help women at that stage of their life.
Oh, thank you for that question. Yeah, so that's actually when I started. I was 52, going through menopause, as I say, having hot flushes, wearing shorts and flip-flops when it was 35 degrees outside because I had my own internal summer. So I literally made the change, and within less than 2 weeks, all my hot flushes went away. And that's just by eating whole food, plant-based. So again, no matter what stage you are in life, there's benefits. The earlier you start, obviously, the more ideal it is, but it doesn't matter what age. I've seen women who have made substantial changes much later and much older than me, and reversing diseases, reducing their weight, feeling more energetic. And one of the other things, as you probably know, is estrogen levels are really plummeting during menopause, and insomnia can occur. So one of the things that I recommend is just increasing whole food soybeans, and which is one of the things that I do to try boost my estrogen a little bit.
Thank you very much. Yeah, I just got some edamame from Costco, so I'll start eating.
It works.
I have a question as well. I just wanted to know, I actually know somebody who was vegan and had a baby and went through the pregnancy as well. I just have a question because I don't know if this is actually true or not. I know some women have cravings, and if they've been vegan for so many years and they maybe indulge in something that's not plant-based, does that affect the mother or the fetus or the baby?
It really depends on how much. I mean, eating anything that's pro-inflammatory, whether it's processed oils or sugar, especially processed foods, they're pro-inflammatory. And so depending on what, it's hard to say in general, but the more they get an imbalance there, the more likely to have more complications. Again, the more whole foods they eat, the better.
Thank you so much for your time.
You're welcome. Thank you.
Wonderful. So we're going to move on now with our second TED Talk with Kristin Kabay. Now, Kristen is a registered dietitian and board certified specialist in sports dietetics through the Academy of Nutrition and Dietetics. Kristen's specialties include sports nutrition and performance, personal fitness training, plant-based nutrition and health and wellness coaching. She describes herself as a plant-based athlete and an endurance junkie. In her talk today, Kristen will focus on meeting protein requirements for athletes and weekend warriors. Let's turn it now to Kristin Kabay.
Hello, everyone. Give me 1 second. I'm going to share my screen. All right. All right. So I am really excited to talk about this topic. It's something that I am, really passionate about. And so whole food plant-based diets, the athlete, and protein. Are there differences? Okay. And I like to always start with something a little funny. You know, there's so many misconceptions and so much kind of mythology around protein and, you know, sickly, weak vegans. And hopefully today, I think I'm kind of preaching to the choir here a little bit. But if maybe you're newly plant-based, or maybe newly into all of, you know, changing your diet, that I can dispel some of those myths, or, you know, put some of your fears at ease. Okay. So I like to ask a little bit of questions, and this is something fun that you can do. You don't have to participate. It's anonymous. I'm not collecting names or emails, but if you scan that QR code with your cell phone, it'll pull up some questions that I'm going to be asking throughout my presentation, and you can answer immediately, and we can kind of see the questions and answers that come up. Okay, so we've got one coming up here in a second, but let me kind of give you a little bit more background on myself and why I think this topic is so important. And also why I think I'm really qualified to talk about this. You know, I have been an athlete for my whole entire life. You can see me there at a very young age with my first sport, soccer, all the way till present time. And I'm actually running the Boston Marathon next weekend. I'm a runner. I love yoga and cycling. I mean, literally anything that I think gets me moving and outdoors. And, you know, kind of back to that previous point of the sickly vegan, I really don't think of myself as that. You know, I've been plant-based, not the definition that we use now, but have not consumed animal products since about the age of 13, and I am almost 40. So hopefully, you know, we're going to talk a little bit about what those needs are in terms of protein and dispel some of the myths. Okay, so here's the first question. If you want to go ahead and answer, you know, where do you fit on this scale? Are you concerned? And if you listen to the media, if you listen to or pick up any magazine or, you know, anything, I mean, there's this just kind of, you know, obsessive focus on protein. And I don't want to say that protein is not important, because it is, and it can be an issue for, you know, whole food plant-based or vegans that may consuming lettuce all day or something of that nature. But by and large, if you're eating a variety, and I'm going to show you how to do that, you really can meet your needs. Okay, so this is interesting. So there are some people that are concerned, and you can keep answering. You know, I'm going to move on here. Okay. So we're going to talk about protein, why it's important, how sports change our needs, what does the research say, and best practices. So, you know, this could be its own entire lecture in and of itself, but protein is extremely important in our body. So I don't want anybody to leave being like, oh, you know, I don't have to worry about this. It is important, but it's easy to do. So here are some of just very key how protein functions within our body and our brain. It's used to make hormones and neurotransmitters, thyroid stimulating hormones, serotonin, melatonin, all of those important compounds. Then we've got, you know, our immune system. Protein plays a part in, you know, those white blood cells, our T and B lymphocytes, the production of antibodies, something that we're all familiar with after, you know, the past year or so. Protein is absolutely important for our muscles and our bone. I think we forget that protein is what forms the bone collagen. Okay, that matrix there. And then obviously, we all know this, our muscles, they're made of amino acids, of protein. Okay, when you look at even the heart, I think people forget the heart is a muscle. It's made of protein. Okay, and then our GI system. So not only is it the site for digestion of protein and metabolism, but it also secretes proteins, which help us break down different foods that we eat. It is the cells itself have a protein component. So I hope you can see how important this is for our body. So if protein is good, we need more protein is better, right? Well, I'm not going to dive into this too deep. I mean, there's a ton of research around the more protein and where those sources are. But I like that to include just a little bit. This is a data from a research study that was just published at the beginning of the year in the American Heart Association Journal. And really what they were looking at is, if you consumed the highest amounts of plant proteins in your kind of day-to-day versus individuals that were consuming the highest amounts of animal proteins, and again, that would include low amounts of plant protein, what would happen? And there's really an inverse relationship here. So individuals that consume high amounts of plant protein, across the board, we see favorable outcomes in terms of lower rates of cancer, decreased all-cause mortality, decreased rates of heart disease and diabetes and dementia. The opposite is true if you're consuming high animal proteins and very, very, very little, low to no amount of plant proteins. Okay, so I just, again, I think this is so important. And in terms of athletes, now we're taking the health benefits and trying to translate that into how does this meet the needs of the athlete. So we're going to talk about that. So how much do we actually need? What does the RDA say? And the RDA meet the needs of about 98% of the population. So it's not that, it's only 3% or 30%. It's going to cover almost 100% of the population's needs. And that is only 0.8 grams per kilogram. So if we took a 150-pound person, that's about 50 grams or so of protein that you would need a day. And if you're 200 pounds, how that goes up. And this is based on your weight. So it's not a percentage of your total calories, but it's based specifically on you. And for athletes, what we find is that, you can even take this a step further for those elite level athletes. What they'll do is then look at how much muscle mass they have. And if you're somebody that's trying to build, then you can even make that protein amount tailored to the amount of lean muscle tissue that you have. So, and again, not to say that we don't need to be concerned, because there are instances where protein is definitely an issue. And these really stem from this muscle loss and muscle wasting, okay? But this is really in the presence of a complete absence of, protein, or very, very minimal intakes of protein and calories, something that we would see maybe in developing countries where there is a true food insecurity. For the average American walking around the country, protein, they're getting plenty. I think that the average intake is about 100 grams a day, which you can see is way more than that 0.8 grams, for those weight categories, all right? So who may need more protein? And again, nutrition is not black and white generally. There's lots of caveats, but these are some demographics where the protein needs may be a little bit higher. So obviously we're here to talk about athletes, and really this is they're building muscle in a lot of these states. So up to about 2.2 grams. Sometimes in elders, and again, this is really seen more in terms of that malnutrition. So that muscle loss and muscle wasting, something's not going on. And so maybe that boosted protein needs may be necessary. Again, in infants, again, growth and development. And remember, this is based on body weight. So it's not like, you're giving 100 pounds, it's a small amount, but the needs are increased. And the same is true with pregnancy and lactation, growing a human life, and or producing milk in those instances, all right? In some disease states, you may need a little bit more. And again, these are associated with, again, that muscle wasting, that something is going on in the body, all right? But I want you to notice, all of these are just very, very minimal above 0.8 grams. So it's not like, 5 grams or 4 grams. It really is pretty small, that increase, okay? And so kind of think about that, when we compare this to how much the average American is eating, 100 grams a day, this is way, way, way more than what we actually need, okay? So how does sport actually change our needs of protein? And here are some of the big ones, but, you're working. That exercise is a stressor to your muscle. So it's a recovery, nutrient, if you will. So exercise, lifting weights, running, all of that high impact actually can, put a lot of stress on that muscle tissue. And so that extra protein that can help to make those muscles and bones and everything recover a little bit better. Amino acids are actually used to make muscle tissue. If you're trying to build muscle as a strength or power athlete, that's important to you. Again, I think we forget, the stress, the compounding stress that we see when you're running and jumping. That is going to put stress on the bones. And so it's important to get enough protein so that we don't end up with stress fractures or something of that nature. And then in a very small amounts, protein can actually be used as an energy source. So branched chain amino acids, especially the leucine component. Okay. So I like to share this because I think it's very helpful for people, especially those that are starting out in a plant-based diet. You can see, look at the amounts of protein that I have highlighted for you. They're significant. It's not like it's 1 gram or 2 grams. If you're consuming, peas and lentils and tempeh and tofu, those whole plant foods, oats and quinoa, you're going to get a lot of different protein. And like we talked about in the previous, discussion, look at those micronutrients. Look at all the stuff that comes compartmentalized with that protein. So you're not just getting protein, but you're getting calcium and iron, magnesium, all of your B vitamins, copper. I just think that that's amazing when we know that micronutrient intake for kind of the average American is not so great. And then again, we see the fiber. So that is a really, kind of like a superfood that we just don't talk about. But fiber is essential, for our gut microbiome, blood sugar regulation, all of those. It helps kind of minimize the impact of sugar. So lots of other benefit to plant proteins than just the protein itself. Excuse me. And so I like to put this into kind of what does a nutritional needs for an athlete look like in a day. And this is a 150-pound female that runs and lifts weights 3 days a week at a moderate intensity. And you can see, if you're consuming a variety of different plant foods, oats and flax, and, I do use protein powders, hemp or pea or soy, quinoa, all of these different, even a mix of vegetables, you're going to get adequate amounts of protein. So this is 84 grams. And this works out to about 1.2 grams of protein per kilogram for this 150-pound person. And so you remember I told you that the average, kind of baseline is that 50 grams. So it's absolutely, more than what you kind of need just to cover your bases. As an exercising individual, you can see that you definitely can get that amount without and again, look at this. Now it's high fiber. You're looking at the saturated fat, which we know is, if you have a high intake of, saturated fats from red and processed meats, full fat dairy, those things are correlated with higher LDL cholesterol, disease, all of that stuff. So on this whole food plant-based diet, those fats, saturated fats in particular, are much lower. And this 38.6 grams roughly works out to about 20% total fat for this food meal example. Okay. So let's look at a little bit some of the research, and this might not be how you think about it, but I want to kind of talk about why I think that some of these misconceptions exist around plant protein, where they come from. And again, research is always evolving. So where they kind of start is here. So your body needs these certain essential amino acids. We do not make them. We have to get them from, an outside source. So that's why we consume protein. So here are your 9. And it was thought that, have an issue with my clicker. The kind of the way the FDA talks about it now is that protein is really thought to be kind of the digestibility makes it a better protein. So can your body actually digest it? And remember, plant protein has a lot of fiber and all of that wrapped with it. And then that amino acid profile. So does it have all of those amino acids, in what amounts, and how available is it for your body to be used when it's digesting? Okay. And so we call this the PDCAAS, or protein digestibility corrected amino acid score. That is a mouthful, I know. But right now, if we use this, really animal proteins get a higher ranking. Okay. And I'm going to show you what some of those are. Here is for our plant proteins here. And right now, the perfect score, the score to beat, is a score of 1. And then it's, associated with 100% digestibility of the egg. There are some difference along in terms of how we rank this. Are showing that plant proteins are absolutely, completely fine. And really what I want you to take away from this slide, and I'm not going to read all of these, I'll explain a little bit more in a second, but all of your plant proteins, they have all of those amino acids. So I think the biggest concern for a lot of people when they look at protein, sources and, is that a good source of protein, is that they're worried that they're not going to get all of those essential amino acids. All plant proteins have all of the essential amino acids. They just might be in a little bit lower amounts in some. And so you can see under like hemp, lysine is a little bit lower in hemp protein. Rice, lysine is a little bit lower. Okay. And so I've listed some of those for you. But remember, I showed you that we need about 50-ish grams. If you're 150 pounds, you need about 50 grams of protein, when we know that the average American consumes about 100 grams of protein. Really, this concern for how much protein, how much of these amino acids, is this a good quality? It really goes out the door because we're all eating way more than we actually need. Okay. And so maybe that would be a concern, consuming 20 grams or 30 grams of protein a day, because that's, again, less than what your body actually needs. But if you're consuming that amount that is, based on your weight, you're gonna get enough. You will get enough. Okay. So, take home message. Remember, all plant proteins contain all amino acids, just in various amounts. And I would be, I think it would be doing a disservice if I didn't just discuss this. I know this is not necessarily part of how much protein we need for athletes, but I work in private practice and I see a lot of young athletes. They're interested in plant-based diets, and one of the biggest concerns that they have is, what is the cost to the planet? And so we can see that those plant proteins, they have minimal impact on the planet in terms of, their effects, but also in terms of their production costs. How much does this actually cost? And so we see the flip side of, beef and some of the animal proteins, there. Okay. So I just like to talk about this. I think it's always like a nice little glimpse of hope and light when I see younger plant based athletes coming in and they're concerned about these. So that's a good sign for me. So what are the recommendations and best practices? And I'm not going to read all of this, but really it goes by, the intent of that particular athlete. What are they trying to do? What is their sport? What is the functionality of their sport? So strength and power athletes should be no surprise. They really do need the most protein. So up to about 2 grams per kilogram per day. And then, thinking about somebody that, maybe a lower intensity sport, or your weekend warriors that really are not exercising as intensely that frequently. We see here down, yoga and Tai Chi and walking about 0.8 grams. So really no more increase in that protein, than what is recommended for the kind of average intake. Okay. And various amounts. And again, these are very, very small increases in proteins. So in visual, because I'm a visual learner, this will maybe stick in your head. This is really where most people, even athletes, should spend most of their time. And this is the athlete training plate. You can see, half of that plate is filled with fibrous fruits and veggies, 25 whole grains. If you're someone that's trying to maybe watch your weight a little bit, this might be a better, kind of approach. Plant protein, watch what happens to that protein as the training intensity increases. So it's 25% here. And then when we see, moderate intensity, so this might be about an hour a day, higher heart rates, maybe in that 140s zone. Now we've got more carbohydrate, because really the energy source for all athletes is carbohydrate. It's not protein. Our body does not like to break down protein and use it as energy. It does all of those other important things that I showed you, from bone and muscle to heart and brain. It's got to function. It's not used for energy. It can be if you go over that 2 grams that I showed you that strength and power athletes need, really all that's happening is that you're storing those as fat or carbohydrate. They are converted into both fat and carbohydrate and stored as excess calories. Okay, so the protein stays about the same, and then the carbohydrate needs go up. And so on a hard training day, you might see something like, and by that I mean you're exercising 2 hours, 3 hours. Think about your Ultramans and Ironmans. Those individuals are out there, running and cycling and upwards of 3 hours plus every single day. So they're absolutely going to need more whole grains, pastas, rice, and oats. I do like whole grain bread and potatoes and sweet potatoes, all of those things. The fiber is decreased. So before you're starting to go out, on a run or a swim or whatever, you don't want to just load up on fiber, because it's going to sit in your gut. That delays digestion. And so in this instance, a little bit is better than a ton. All right. So last question, and I kind of borrowed this from somebody. Christopher Gardner is a very prominent researcher at University of Southern California, and he presents some of these. He presented this particular question to a group of nutrition professionals, and really asked them, answer this for me. What is the correct response to which of the following statements is most accurate regarding protein derived from plant foods? And most of them chose this: some plant foods are missing some essential amino acids. And we know the answer is all plant foods contain all 20 amino acids, essential and non-essential. Remember that. I think that's what I want you to take forth and feel confident in what you're doing. Know that if you're eating a variety of plant foods, if you're eating enough calories, that can be sometimes an issue. You don't want to be sitting there eating just salads all day long. You need some substance, because plant foods are protective in that they are high nutrient dense, typically lower in calories, but make sure that you're still eating the right amounts and the right types, and you just don't want to eat just green, leafy greens all day long. Good is good, but definitely making sure to get a variety. Here are my references if anybody wants to see those. Any questions, comments, concerns?
Thank you, Kristen. That was so informative and so good. We actually do have a question in the chat. It says, how does Ms. Kabay encourage athletes to switch from animal milk or whey-based protein shakes that are so popular at GNC to more plant-based protein shakes?
No, I think that's a really good question. And there are so many plant proteins on the market. The biggest thing you want to look for is the additives, because still it is a processed food. And if you find a lot of sugars or, flavorings and that kind of thing, you don't want that. And so I would look for something. There are products that say literally just hemp protein, just pea protein, just soy, and those are going to be okay. You might find something on your own. If you have questions, you can always, email me. There's just too many kind of brands to give you a specific, but they do exist and there's a ton. So again, if you need specifics, email me and maybe we can talk that way. But they do exist, and even places that make smoothies for you. I'm a big smoothie lover. They now have that plant option, that plant-based protein option when you go in. So.
Okay, our keynote speaker said, excellent presentation. Can you please show your email address again? It disappeared before I could take a screenshot.
I'll put it in the chat.
Okay, yeah, because that's Dr. McKinney also asked for it. Another question is, does the body recycle protein?
Well, so it's not necessarily that it's recycled, I think, like something like a cholesterol. But it is, you're kind of in this balance of, nitrogen, this kind of nitrogen balancing. And so you will use whatever you take in and, going through the urea cycle. And I don't like to get so sciencey because most people are like, what are you talking about? But it'll excrete, and it has, so that's one of the concerns of, for the average American, if they're consuming just a ton of plant proteins, what is that doing to things like their, if you're somebody that, older and maybe don't have the best, health, you're consuming all of this protein, that's absolutely going to have an impact on your kidney health, because what makes protein different than carb and fat is this nitrogen compound, and it comes at an expense that your body has to, digest that and do something with it. So, yeah, I hope that answered the question.
Another question is, can you please share your feedback on almond milk, soy milk, and coconut milk? Are they processed too?
So, and that's where we get into like the little nuances of what processed means. When I think of processed and I think of minimally processed, it's kind of on a spectrum. So I like to use the example of like an apple or even a potato. That's even a better one. So take the potato in and of itself, which I feel like has been just demonized. And if you eat it in its whole food form, baked or steamed, it's amazing. It's loaded with potassium. It's so good for you. But when we add to it, so maybe we've chopped it, does that mean it's processed? Well, maybe not really. But maybe we add some salt to it. Does that mean that it's processed? Maybe. So the more you add to, the more we get away from that whole source. And then we end up with things like, maybe it's a French fry, then it's potato chip. And then, maybe somewhere along that line, it's like potato flour. The more we remove from the natural source, maybe the more processed and potentially the more unhealthy it is. So in regard to the kind of milk question, it's kind of the same. See almond milk that has a lot of additives in it, sugar and more fats and oils. That's probably not the best. Now there are some that are literally just almond, like that's the ingredient, and those are the ones that you want to look for. There are a lot that now contain like pea protein. I think again, it may be helpful for some, but if you're eating, beans and lentils and tofu and tempeh, you may not need that protein in your milk. So I think it just depends on you and what you're looking for. And I do use, flax milk and things like that. So I think that they're okay if you're knowing what's in the ingredient list.
That's all the questions I see in the chat, but you guys are welcome to unmute yourself and directly ask your questions.